Hi, friends, welcome to my YouTube channel Nursing Classes, a place where you get nursing competitive exam MCQ and theory classes. आज की इस वीडियो क्लास में हम एम्स भुवनेश्वर नर्सिंग ऑफिसर एग्जाम 2018 का क्वेश्चन सॉल्व करने जा रहे हैं। शुरू करने से पहले अगर आप लोगों ने मेरी YouTube चैनल को सब्सक्राइब नहीं किया है तो सब्सक्राइब करें और बेल आइकॉन को क्लिक करें जिससे मेरे आने वाली वीडियोस का नोटिफिकेशन पहले मिलेगा। अगर पिछले वीडियोस नहीं देखा है तो प्लेलिस्ट में जाकर देख सकते हैं और वीडियोस के डिस्क्रिप्शन में भी लिंक प्रोवाइड करवा दूंगा। अगर व्हाट्सएप में वीडियोस का लिंक चाहिए तो पर्सनली व्हाट्सएप मी, माय व्हाट्सएप नंबर इन डिस्क्रिप्शन बॉक्स। अगर वीडियो अच्छी लगी तो एक लाइक कर देना और अपने दोस्तों के साथ शेयर करना। चलो अब शुरू करते हैं। Excerpt. Which of the following types of need represents the need for individuals to reach their full potential through development of AIIMS capabilities? A. Self-esteem needs. B. Security needs. C. Self-actualization. D. Physiological needs. Correct answer C. Self-actualization. 62. Delusion is a disorder of A. Thought. B. Memory. C. Judgment. D. Perception. Correct answer A. Thought. 63. What are the values of temperature and time employed for autoclave in a routine bacteriological laboratory? A. 132 degrees Celsius for 8 minutes. B. 140 degrees Celsius for 25 minutes. C. 110 degrees Celsius for 30 minutes. D. 121 degrees Celsius for 15 minutes. Correct answer D. 121 degrees Celsius for 15 minutes. 64. The best way of increasing the nutritive value of pulses is A. Germination. B. Mixing pulses. C. Parboiling. D. Fortification. Correct answer A. Germination. 65. General fertility rate refers to A. Number of live births per 1000 pregnancies. B. Number of live births per 1000 female population. C. Number of live births per 1000 females in reproductive age group. D. Number of live births per 1000 population. Correct answer C. Number of live births per 1000 females in reproductive age group. 66. Which of the following action guiding theory explains that the rightness or wrongness of an action depends on the consequences of the action? A. Deontologic. B. Beneficence. C. Non-maleficence. D. Utilitarian. Correct answer A. Deontologic. 67. Vaginal bleeding occurring before 28th week of gestation indicates A. Incomplete abortion. B. Inevitable abortion. C. Missed abortion. D. Threatened abortion. Correct answer D. Threatened abortion. 68. Activated partial thromboplastin time is prolonged in A. Thrombocytopenia. B. Thrombosis. C. Hemophilia. D. Bone marrow depression. Correct answer C. Hemophilia. 69. Primary apnea lasts for how many seconds in newborn infants? A. 5 seconds. B. 10 seconds. C. 20 seconds. D. 30 seconds. Correct answer C. 20 seconds. 70. All the following are signs of placental separation and descent except A. Fundus becoming rounder. B. Shortening of cord. C. Small fresh blood loss. D. Lengthening of cord. Correct answer B. Shortening of cord. 71. All the following are natural contraceptive methods involving abstention except A. Calendar method. B. Observation of cervical mucus. C. Diaphragm. D. Observation of body temperature. Correct answer C. Diaphragm. 72. The exercise that involves muscle contraction with resistance is called A. Isometric exercise. B. Isokinetic exercise. C. Isotonic exercise. D. Aerobic exercise. Correct answer B. Isokinetic exercise. 73. All the following are biological risk factors for altered family health except A. Birth defects. B. Mental retardation. C. Genetic predisposition to diseases. D. Air pollution. Correct answer D. Air pollution. 74. Electronically transmitted clinical consultation and treatment that has improved the access to care is called A. Remote care. B. E-health. C. Telehealth. D. Rural health. Correct answer C. Telehealth. 75. After fertilization, implantation bleeding usually occurs after approximately how many days? A. 20 to 28 days. B. 6 to 12 days. C. 14 to 18 days. D. 2 to 4 days. Correct answer B. 6 to 12 days. 76. Marked inflammation of the gums is called as A. Periodontitis. B. Cheilosis. C. Caries. D. Glossitis. Correct answer A. Periodontitis. 77. Sterilization of surgical equipments is done by A. Autoclave. B. Formaldehyde. C. Sites filter. D. Radiation. Correct answer A. Autoclave. 78. Palliative surgery is done A. To remove the disease. B. To reduce the intensity of illness. C. To improve self-concept. D. To confirm the diagnosis. Correct answer B. To reduce the intensity of illness. 79. Human chorionic gonadotropin is produced by A. Yolk sac. B. Syncytial trophoblast. C. Cytotrophoblast. D. Decidua. Correct answer B. Syncytial trophoblast. 80. Health illness continuum and high-level wellness models demonstrate A. Importance of family. B. Wellness as a passive state. C. Health as dynamic state. D. Illness as fixed point in time. Correct answer C. Health is dynamic state. 81. Profound hearing loss is described as greater than A. 20 decibels, B. 80 decibels, C. 40 decibels, D. 60 decibels. Correct answer B. 80 decibels. 82. The most satisfactory method of refuse disposal where suitable land is available is A. Burial, B. Control tipping, C. Manure pit, D. Dumping. Correct answer B. Control tipping. 83. Endotoxins produced by gram-negative bacteria are usually A. Proteins, B. Fatty acids, C. Lecithin, D. Lipopolysaccharides. Correct answer D. Lipopolysaccharides. 84. Islets of Langerhans are rich in which part of pancreas? A. Body, B. Tail, C. Head, D. Neck. करेक्ट आंसर बी टेल। कैसी लगी यह वीडियो कमेंट करके बताएं। अगर अच्छी लगी तो अपनी दोस्तों के साथ शेयर करना एंड डोंट फॉरगेट टू सब्सक्राइब। थैंक्स फॉर वॉचिंग। सी यू इन नेक्स्ट वीडियोज।